is the mapping lecture for Booth admin book for this Medic 225 course. You have to forgive me, I'm a little hoarse today. My allergies are something else today, so bear with me. So we begin today with the mapping, like we always do, with a list of questions over on the left-hand side. And so these are the things that we want to find out by the end of the lecture. And so what I want to know are all of these things here. What is the layout? What are the typical features of your standard office, medical office exam room? What is the difference between sanitization and disinfection? What are the steps to prevent the spread of infection in the exam and treatment rooms? That's always important to know. Why are temperature, lighting, and ventilation in the exam room important? And then the last question I want to answer by the end of the map is which instruments and supplies are used in a general physical exam? And then how do I arrange and prepare them for that general physical exam? So we start here with the layout features of the exam room. And we begin by talking about the ideal structure of the medical office. And so ideally, each practitioner in the medical office will have at least 2 exam rooms. And this is so that one area can be prepared while the other one is in use. So if you work in a single physician practice, you really only need to have 2 exam rooms, although most have between 4 and 5. But if you work in a larger practice, like a multi-physician practice, and I'm going to note this over here, larger practices may have wings where there are several hallways, each of which will lead to a different wing or a different area of the practice. And those larger practices, if they have 10 doctors, they can have, 20 to 30 exam rooms in them. So it's good to know. And if you've ever been in a very large practice where there are many physicians seeing patients in there, you know that there are several hallways that you can go down, and there are lots of different exam rooms in there. So we want to make sure that there's enough rooms in the practice so that while the physician is in with one, or the provider is in a patient in one room with a patient, the other room is being prepared for another patient to come in. So that way the patient isn't waiting any longer than necessary, and that way the provider's time is maximized as efficiently as possible. So the typical exam room size is about 8 by 12 feet, and it has the doors and the interior walls that are soundproofed to help ensure privacy. Because it's no fun when everybody in the next room over can hear all of your medical information being discussed with the provider because the walls are very thin. So most walls now in medical offices are somewhat soundproofed to help with that whole HIPAA compliance and protecting patient privacy. The room may also have an area for the patient to disrobe, or it could be a separate area of the facility that may be used as a locker room. So depending on what type of facility it is, if it's a radiology facility, often there's a locker room and that will have a disrobing area. If it's an OBGYN practice, sometimes there's a little disrobing area there. So it just kind of depends, but sometimes there's disrobing areas or locker rooms, sometimes there is not. The patient's medical records may hang on the wall outside of the exam room, or if the records are kept electronically, the room will have a computer station. Now, with the mandate of EHR, which you guys will be learning about very shortly, most most places, medical offices, and hospitals will be required to have computers now. So paper charts are kind of a thing, they're quickly becoming a thing of the past, and computers have taken their place because of this EHR mandate. EHRs require computers. And then there's also usually a light or other device on the wall or a door that's used to signal that the room is occupied. Now, sometimes that will be a red green light, sometimes it's just a white light that is flipped on when the patient is in the room or flipped off, when the patient has exited the room. So it's just some type of indication light. And then within the room, the furnishings are arranged for efficiency and for physician convenience, and then also for patient comfort. So the furnishings could include one or more chairs, a rolling stool, a scale, trash can, biohazard sharps containers or biohazard trash cans, a high intensity lamp and for examinations or procedures, wall brackets to hang the instruments such as a blood pressure cuff on otoscope or ophthalmoscope or anything like that. So pretty standard stuff that you see in most medical office exam rooms. It's kind of standard issue equipment when it comes to stocking and setting up those exam rooms. And all of those things are there every time you go, but they are in that room strategically so that it is efficient for the provider to see, examine, and treat the patient in a very time conscientious manner. And then lastly, under the layout and features of the exam room, we talk about the special features that are related to ADA accessibility guidelines and those that are required by the ADA Amendments Act of 2008 are also needed for an exam room. And some of those include things like wider doors to be able to fit wheelchairs through, any accessible restrooms that have grip bars on the sides to help with accessibility there, sinks that are at wheelchair height. If those are available in all of the exam rooms, they may need to be at wheelchair height, or in the restrooms, they may need to have wheelchair height sinks as well. So the Americans with Disabilities Act requires the practice to consider those accessibility issues when they are building out these physical locations and these exam rooms. So moving on to the difference between sanitation and disinfection of instruments. I had to go up here and change sanitation to sanitization because I realized after I said that this was wrong, so it should be right now. But the difference between the two, we start with sanitization, and that is the scrubbing of instruments and equipment. Those instruments that are dirty should be sanitized immediately after they're used. We do not want tissues or blood or anything to dry on the instruments. And I know this sounds really gross, but it is hard to get thin layers of tissues off of metal instruments, and sometimes the old blood that dries can get stuck on there and pretty well, and it's a little bit difficult to get some of that out of some of the hinges of utensils or creases of instruments, and so you want to make sure that as soon as the instruments are done being used, you are sanitizing them right away. Now, many offices will have like a sanitization bath, and so let me write this in. What it is usually some type of like bucket, or one office that I worked in had like a step on trash can type deal. It was like a metal trash can, and it was filled with the solution, and we just threw all of our dirty instruments in there when we were done. And so they were always just kind of in the sanitary solution, waiting for us to go then and disinfect and autoclave. So you also need to make sure that you are careful with all of the instruments. Any nicks or scratches on them could affect their performance. And it can also create a place for bacteria to gather, which is never a good thing when we're using those on people. You should always make sure you're wearing gloves as part of the sanitization process because they serve as a barrier against infectious material. You want to make sure that the sharp instruments should always be separated from other equipment. And you do this for the same reason that you are supposed to wash knives separately from all other dishes. It is so that you primarily do not cut yourself, so that you are not injured, but also to avoid damaging any other tools. You want to make sure that you scrub one instrument at a time in hot soapy water, and use these small plastic nylon brushes. I forgot to write nylon in here, but usually the brushes are nylon. And then we let them dry thoroughly. So after the instruments are thoroughly dry, then you want to make sure that you check them all and that they're functioning properly. And anything that is not functioning properly would need further attention, and that would then just need to be set aside for sterilization. Any manufacturer's guidelines should be followed for rubber and plastic products, since certain detergents can break down the rubber or the plastic. So you want to make sure that you are following any manufacturer's guidelines on the sanitization solutions that you're using. And sometimes we have to use ultrasonic cleaning for the super delicate instruments, and that is because the ultrasonic waves will loosen up any debris or tissues or contaminants that are stuck to those instruments and make them much easier to clean. Okay, so the difference between sanitization and disinfection is that sanitization basically just cleans up the instruments, and disinfection destroys most of the microorganisms that could be living on them. So, although it destroys most of them, bacterial spores can resist very harsh conditions. And so, some bacterial spores are not destroyed in the disinfectant um, process. And so, we use other things other mechanisms to destroy those bacterial spores. Disinfectants are used on instruments and equipment. And antiseptics are different because they are cleaning products that are used on human tissue. So one of the common antiseptics that's used is called Bactine, and we use that to clean up wounds or to clean up scrapes or abrasions on people. And one of the common disinfectants that we use in the medical office is bleach. We would not clean people with bleach because that's abrasive to skin and it would burn, and it's not very conducive to wounds with hurt. And so there's a big difference. You want to make sure you know the difference between an antiseptic and a disinfectant. So the disinfectant cleans instruments and equipment, and antiseptics clean human tissue. So the advantages and disadvantages of various disinfectants are aplenty. It really kind of depends on what types of things you are disinfecting. If you are disinfecting countertops, if you are disinfecting instruments, if you are disinfecting various things here, there's a whole list of them here that we're going to talk about in just a second. But you really just kind of want to weigh out the advantages and disadvantages of the various disinfectants to figure out which one is the best for you to use for any given job. So enamelware, glassware, laryngoscopes, and nasal specula can all be disinfected and reused without being sterilized unless they are contaminated by blood or blood products. So most of the time, anything that's going to live in um, spit or sweat or um, nasal secretions, those can all be killed off with just basic disinfection. Anything that has blood or blood products on it has to be ran through the autoclave and sterilized because we can't disinfect away some of the things that are living in blood. So we want to make sure that if there's ever any blood or blood products on any of those items, that we are making sure that we run them through the autoclave for sterilization. We also want to make sure that we are choosing the correct disinfectant. And to do that, we follow the manufacturer's guidelines, of course, as we do for most things. And then disinfectant supplies should be handled with care so that we prevent any contamination or prevent contaminating any surface that later may be in contact with a patient. So we want to be mindful of that as well while we're using these disinfectant supplies and disinfecting things, that we're not laying dirty instruments on some place that a patient could touch later, and also that we're not leaving chemicals laying around that could be in contact with patients. All right, so that pretty much sums up the sanitization versus disinfection up here. And move on and over to, let's see, preventing the spread of germs in the exam room. So we start here with infection control. I cannot stress to you enough, you will hear this probably 1,000 times throughout this program. I know that this course is offered, typically most students take this 225 course at the very beginning of your MA program here, and you will hear this over and over and over and over again, especially when you get to the 221 classes, that hand hygiene has to be your top priority. Washing your hands is the cornerstone of infection control. Infection control literally begins with washing your hands properly. And so the number one way that we prevent the spread of germs and bacteria and viruses in exam rooms where people are coming in sick and carrying bacteria, germs, and viruses all the time is by washing our hands. So making sure that you are washing your hands before and after every single patient, or using hand sanitizer before and after every is incredibly important in the prevention of spreading germs and viruses and bacteria from person to person in the medical office. We can also prevent the spread of germs by making sure that we are changing the table paper after each patient. So we pull the table paper that any patient has sat on, tear it off, throw it away. Any paper that has been covered by or has been soiled by any bodily fluid should be disposed of in a biohazard waste container. So the regular table paper can go in the regular trash. It does not need to go in the biohazard. But if it has blood or bodily fluid, urine, fecal matter, anything, any bodily fluids, then that needs to go into biohazard. And then, if necessary, we can use the Sani wipes to remove the lubricant that is often used during rectal or vaginal exams. Sometimes, I know this sounds gross, but it happens sometimes when a patient sits up after they have had a rectal or vaginal exam. Gravity does its job, and what has went up comes down when the patient sits up. So it sometimes ends up on the table, a lot, and we have to just make sure we clean that up. And it most of the time will end up on the table paper, which we're going to throw away anyway. But if it has landed on the table paper, it is probably leaked through that a little bit, and so we just want to use those Sani wipes that we talked about a couple lectures ago to remove the lubricant and make sure that the table is sanitized and disinfected. We can control the spread of germs on surfaces like countertops and tables and the sink by treating them with a disinfectant such as a 10% bleach solution. All of these surfaces should be routinely cleaned and disinfected. It's a doctor's office. There are sick people there, so you want to make sure that you are wiping everything down, fairly regularly, because people cough, things go through the air, people don't cover their mouths, or they do cover their mouths but don't wash their hands, and then they touch all over the exam rooms. And so we want to make sure that we are routinely cleaning and disinfecting all of those surfaces as well, and that they are not overlooked. If there are any toilets in the exam rooms, sometimes there are toilets. Like sometimes there may be like a bathroom that is between two adjoining exam rooms, so like a shared bathroom. And if that's the case, you want to make sure that those are cleaned as well. Sometimes there's the restroom's entirely separate and it's down the hall someplace. But regardless of where the toilet is, those bathrooms, restroom areas need to be maintained and disinfected as well. And then lastly, in preventing the spread of germs in the exam room, we talk about storage of biohazardous specimens. So often during an exam, a specimen will be collected from the patient, such as like blood, draw blood, or we'll have them, go and urinate in a cup so that we can do urine testing. Sometimes they have sputum samples and they'll have to cough or, produce sputum into a cup. We have semen analysis that is collected into a cup. There's all kinds of things that go into specimen cups, and um, those specimens all produce the risk of spreading infections through inhalation or ingestion or absorption through a cut in the skin. So we want to make sure that we are following all of our OSHA regulations, which require biohazardous materials to be stored appropriately. If they have to be stored in a refrigerator for any reason, as sometimes they do in a medical office, I know that sounds gross, but sometimes they do because we have couriers that come and pick them up in the evening, then they have to be stored in a separate refrigerator from food or beverages. You do not want to put your Coca-Cola and your egg salad sandwich in the refrigerator with somebody's urine and semen specimens. That's just gross. That alone should be enough to gross you out, so that you would not want to put food in there. But aside from the fact that it's an OSHA thing, it's just gross. Any fridge that is housing any biohazardous materials also has to have a cautionary label stating that its sole use is to store biohazardous material and so that no food can go in there. And I think that's it for preventing the spread of germs in the exam room. So we can move on over to the temperature, lighting, and ventilation in the exam room. And over here, we start with the temperature of the room temperature is important because patients may experience a wait between the time that they are gowned and when they see the physician. So if you have ever had to disrobe in the physician's office, your doctor's office, you're sitting there and you're in this really thin paper gown and it's freezing in there and you are waiting for half an hour for your doctor to come in, freezing in this tiny little paper gown that doesn't cover half of you, you know that it's super awkward, super uncomfortable, oftentimes kind of cold. It's not really that great of an experience. And so we want to be mindful of what temperature the room is set at so that if that's the case and patients have to wait in a gown between, you know, when the wait for the physician while he's finishing up with other patients, that they're not sitting there in a 60-degree room freezing. So in order to do that, we keep the room at 72 degrees, and that can help with comfort levels. And some facilities may also offer patients warm blankets. We see that a lot in like oncology offices where people are going through chemotherapy. We see it sometimes in other types of treatment facilities where they treat a lot of elderly patients, and elderly people tend to have thermal regulation issues with their body temperature, and so sometimes they offer warmed up blankets, which is really nice for patients. So that's helpful. The second point is lighting, and while dim lights may assist a patient in feeling calmer because nobody likes to be under those vibrant lights that make you feel like you're a specimen in a lab, the practitioner needs to be able to see the area clearly in order to treat the patient. So at times, a separate light may be of assistance to illuminate specific areas, and that's why we have those floor exam lights. And so Otherwise, adjustable lighting in the office, like a dimmer light switch, is best. It's kind of best case scenario there. And then lastly, you should know about the ventilation issues that can affect the exam room. Ventilation can be difficult when the exam or treatment rooms don't have any windows. Even the ones that do have windows, I've noticed, are very rarely open. So ventilation kind of becomes an issue for quite a number of practices. So odor absorbing filters or high speed blowers can be used to freshen up the air. And these become very important if you have a patient who is a heavy smoker, or if you have a patient who has some hygiene issues and they have a very distinct trail that they bring, or that they leave behind them, an odor trail that they leave behind them. It makes it very uncomfortable for the next patient who has to go in that room after that patient to sit in that smell with the odors in the air. So we want to make sure that the ventilation is appropriate for the exam rooms. And also, one other thing with the ventilation is that you want to make sure you're paying attention to any adjustments in the room temperature because ventilation can sometimes cause adjustments in that room temperature. So if the room temperature gets really hot, then the ventilation may not be working, or if it gets really cold, then the ventilation may be working too well. So it just kind of depends. So one thing to keep in mind is you may want to temperature, and that may be linked to the ventilation issues. All right, so moving on, I think to our last section, we have the instruments used in the general exam. And we start here by talking about how we arrange and prepare the instruments. So what you need to know here is that each doctor or each provider is going to have a personal preference on the arrangement of instruments and supplies. And so basically, they have been trained in a very precise way of performing the general physical exam. However, they went through the process in school, however, they were taught in school, is how they are going to expect the instruments to be arranged. And so they will train you, somebody will train you so that you get it right and that you have those instruments in order of the way that your provider prefers them to be. Some of those items may be carried with the physician. So sometimes, the physician probably carries the reflex hammer or the pen light with him. Sometimes they carry the otoscope with them. Some of them, though, could be mounted to the wall. The ophthalmoscope may be mounted to the wall, or what the blood pressure cuff, the sphygmomanometer may be mounted to the wall in that office. It just kind of depends. So those things could be with the physician. They could be mounted on the wall. They could be set out on the countertop. You just want to make sure that they are arranged however it is that the physician likes them to be. Or if they are wall mounted or set out on the countertop, that they are in the room when they are supposed to be there. For procedures, instruments are generally set out on a towel or a tray in a prescribed order, and that order is again preparation for some of the instruments can add to the patient's comfort, such as warming the vaginal speculum or warming up a laryngeal mirror. So if you are a lady who has had a pap smear done, you know that cold speculums are no fun for anyone. And so those little touches can, like warming up that vaginal spec, it can make a world of difference in patient care. While learning this individual plan for the physician's order is important, the physician will expect that all the instruments are in working order and that they've been properly sanitized, disinfected, and sterilized if it's indicated. And also, you should, in regards to these instruments, you should be regularly checking to make sure that all the supplies are needed for this general physical exam when your doctor will not want to do a pap smear and you at that point when you go to set up for it realize that you forgot to reorder the disposable speculum. So that's going to be an issue. So you just want to avoid that altogether up front by being on top of your inventory. Some of the other instruments may require batteries and should be tested on a routine basis to be sure that they'll be ready for patient exam. And then you should also, as an MA, be familiar with the manufacturer's directions for any maintenance on the units that that you're using in a regular general physical exam on a consistent basis. And then also make sure that the instruments that are used for the exam are cleaned after use according to approved procedures. All right, so go back up here. And these are the instruments that are generally used in a general physical exam. And so we start here with this first row. And we have an anoscope. And it is used, as you might suspect, to open the anus. And it's mainly available for stool sample collection. Now, in this picture, let me zoom this in for you. I have a touchscreen computer. I forgot I'm not on a touchscreen thing. Hang on just a second. On this anoscope, or on this picture, this diagram, you can see that there are 3 of them, and this first one here is the only one that is an anoscope. And then you have the proctoscope, and then you have the rectoscope. Now, the anoscope just goes into the anus. Proctoscope goes up a little further, and then the rectoscope this proctoscope goes up to about where the prostate, like up past the anus, but before all the way into the rectum. And so here you have the rectoscope, which goes up even further, closer up to the bottom of the sigmoid cord. So you can see this guy is going in a little bit further to explore, and then this guy is just basically to open up the external opening of the anus and collect whatever they got to collect and then out of there. So there are different sizes. You do not want to hand a doctor a rectoscope for the job that an anoscope is going to do for obvious reasons. That's not the same thing. The exam wipe is on a flexible arm and it allows for direct light on a specific area of focus. So they can move this around and bend it down if they want to, or bend it backwards if they wanted to, point it either way, and then that way they can focus the light. The laryngeal mirror allows for more precise, more precise exams of on the inside of the mouth and throat. The nasal speculum will enlarge the opening of the nose and will often have a disposable tip because you get some nose gunk on there, so it has like a sheath, like a cover, and it that is on it, and just kind of spreads open your nasal opening a little bit and allows for better viewing. An ophthalmoscope is used to examine the inner structure of the eye. An otoscope looks very similar to an ophthalmoscope. In fact, most times the head on the ophthalmoscope is interchangeable with the head for an otoscope. And so you'll get a unit that looks like this, where one's an ophthalmoscope, one's an otoscope. And this will be the ophthalmoscope. This one would be the otoscope on this pair. Here's another picture of an otoscope. The ophthalmoscope, ophthalmo means eye in medical term. And so, oops, that should go there. Ophthalmoscope looks in the eye. Oto equals ear in med term. And so scope looks into the ear. It's used to examine the ear canal and the tympanic membrane. It usually has disposable tips also because we don't want earwax and it has gets earwax and other gunk stuff on it sometimes, so we want to make sure that um, it's easier to keep hygienic and clean and sanitary by using tips on the ends of the scopes. A pen light will give additional light to a small area. It may also be used to check the pupil response in the eye, make sure they are equal and reactive to light. Moving over here, we have a vaginal speculum, and that will enlarge the vaginal opening enough to make the cervix accessible for visual exam and specimen collection, such as a pap smear. It looks barbaric. It is. All I'm saying about that. The tuning fork can assist in testing hearing. They usually will put it on the mastoid process. If you want to know where your mastoid process is, it is that bone. If you stop right now, feel the bone behind your ear, that hard lump. That's your mastoid process. And they will stick this on the mastoid process and then ping it and then figure out what you can hear. That's how that helps test hearing. Thermometer. Hopefully everybody knows what a thermometer and tape measure are by now, but a thermometer is used to measure body temperature. The tape measure is a flexible method for measuring size or the development of body areas. We do use tape measures for a number of reasons, so it's important to learn how to read them. A lot of students I have do not know how to read tape measures, and it's important to know how to read tape measures. So they measure fundal height, which is how big a mom's belly is while she's pregnant. So fundal height and baby length after the baby's born at well baby checkups, and head circumference at well baby checkups. We have to measure those. So all of those are things that we have to use these measuring tapes for, so it's important to know how to read those measuring tapes. One of the most important tools of our trade, and certainly for our providers as well, is the stethoscope. It's used to listen to body sounds such as a heartbeat and respiratory noise. Second most important, the sphygmomanometer. You know how to say that big long word, you just break it down. So sphygmomanometer. So sphygmomanometer. But it's a lot easier to just call it a blood pressure cuff, because that's what it is. It's a blood pressure cuff. And actually, the sphygmomanometer is not the cuff itself. It is this part right here, the dial. The dial is the actual sphygmomanometer. So we use that to take blood pressures. And then lastly, we have reflex hammer, which is used to check reflex. And those are the common tools for a general physical exam. So I think, is that it? Yeah, looks like that's it. All right. Well, I think that is it for our Chapter 9 mapping lecture. Let's see. So let's go back over, make sure we answered all of our questions. Layout and features of a typical exam room, we got that. We know the difference between sanitization and disinfection now. We know what steps to take to prevent the spread of infection. We know why temperature, lighting, and ventilation in the exam room are important. And we just talked about the instruments that are used in the general physical exam and how we know what to do when we're supposed to repair them. So I think we covered everything. All right. Well, that is all I have for you for Chapter 9. If you guys have questions, make sure to message me in Canvas or email me and let me know. Thanks, guys.